Stopping smoking is the single most important thing you can do to improve your health and extend your life. Smoking harms nearly every organ in the body and is particularly damaging to our cardiovascular system. It can cause a heart attack or stroke. In this section, we will talk about different ways you can work with your healthcare team to reduce your risk of having a second cardiovascular event, such as a heart attack or stroke. As part of the Cardiac Rehabilitation Programme, we can work with you to ensure you get the best treatment to support you to quit smoking. Whether you are thinking about quitting, have tried many times, or are actively working on it, we can help you. You too can be a non-smoker. Getting the right help could make you 4 times more likely to quit cigarettes and then stay off them for good. So how does smoking affect your body and your heart health? There are more than 7,000 chemicals in a cigarette. When you light a cigarette, the burning tobacco releases a number of very toxic chemicals. These are distributed throughout the body, changing and damaging cells, causing harm to every organ, and increasing your risk of many cancers. If you smoke, this may also interfere with the benefits of any medication that you have been prescribed. Let's look at carbon monoxide, a poisonous gas that is released from burning tobacco. It affects your body in 3 ways. When inhaled, carbon monoxide binds itself to the hemoglobin in your blood and chokes off the oxygen in your bloodstream. When the heart and other organs are starved of oxygen, they have to work harder, causing breathlessness and sometimes angina, which means chest pain. Carbon monoxide damages the lining of the blood vessels. It makes it easier for fatty deposits to build up in your arteries and makes you more prone to heart attack and stroke. Carbon monoxide makes your blood stickier, which can cause a clot to form. If the clot breaks loose, it can travel throughout the blood vessels and cause a heart attack or a stroke. Tobacco also includes nicotine, which is an addictive drug. It is a stimulant and will increase your blood pressure and pulse when you smoke, which means your heart has to work harder. Smoking can also increase the bad cholesterol levels and lower the good cholesterol levels in your blood. When you quit, your cholesterol may reduce to more normal levels. Breathing in other people's smoke is known as passive smoking. It is dangerous, particularly for pregnant women, children, the elderly, and those with health conditions. The best way to protect your loved ones is to stop smoking. People who breathe in second-hand smoke regularly are more likely to get the same illnesses as smokers, such as lung disease, cancers, and heart disease. What happens to your body after you stop smoking? It doesn't take long to see the benefits of quitting smoking. Within 20 minutes, your blood circulation will improve, and your heart rate and blood pressure will return to more normal levels. This reduces your risk of heart attack straight away. Within 8 hours, the carbon monoxide level in your blood will drop, and the oxygen level will go up. Within 1 or 2 days, all the carbon monoxide will have left your body. Within a few days, your sense of smell and taste will start to improve. After 3 days, your breathing will improve and your energy levels will increase. Within 2 to 3 months, your lung capacity can increase by up to 30%. Within 1 year, your chance of having a heart attack drops by half. Within 5 years, your risk of getting smoke-related cancers will be greatly reduced. Within 10 years, your risk of having a heart attack drops to almost the same as a non-smoker. In most cases, between 5 and 15 years after you stop, your stroke risk becomes almost the same as if you had never smoked. Your mental health. The good news is that it has been shown that quitting smoking is also good for your mental health. Shortly after stopping, patients experience lower levels of anxiety, stress, and depression, particularly if they attend a cardiac rehabilitation program. Your mood improves and quality of life increases. There are many treatments available to support you on your journey. For example, you might want to try nicotine replacement therapy in the form of patches, chewing gum, or lozenges. Or you might prefer to use a spray, inhaler, or prescription medications. These can make quitting easier. Many cardiac rehabilitation programs include excellent stress management programs that patients find very helpful when they're trying to stop smoking. We can also refer you to support services in your local community. Quitting smoking can be hard, but it can feel even harder if you try to do it alone. Make sure you have the correct support so that you are set up to succeed, not to fail. Giving up smoking can be challenging, but with the right support and treatment, lots of people quit and stay off for good. So can you. In Ireland, we now have more ex-smokers than smokers. Getting the right support and using treatments that have been proven to be effective can quadruple your chances of stopping for good. Talk to your cardiac rehabilitation team or another health professional for advice. You can also get help by calling the National Smokers Quit Line. Staff there can offer one-to-one support over the phone, or they can link you in with your local stop smoking support services. Or you can go to quit.ie for lots of information and support. There you can sign up for the online quit plan, which will guide you through the quitting process day by day.